Remote patient management is about caring for people in their community. It's about moving more healthcare out of the traditional setting into the house, into where people live, work, and play every day. And it's about using technologies to be able to bridge that space gap between the traditional physical setting of healthcare and where people really want to live every day.
Remote patient management is actually a model of care where you're using information technologies to gather data from the patient, but also to provide data back to the patients outside of the traditional walls of medicine, so outside of the hospital, outside of the clinic.
The patient spends 99.9% of their time outside the clinic. So if we get a chance to see what's happening with them behaviorally, we can measure what's going on, we can ask them questions, it lets us know actually what happens on a daily basis.
It's actually sending the right message to the right person at the right time based on what's going on with that data that can move the needle in terms of health outcomes. So that's why when I think of remote patient management, it's much more complex and rich than just monitoring someone and collecting some vital sign readings and graphing them over time.
All of that data that comes up where a clinician actually is looking at that data and able to use that data to better manage the patient. So we talk about remote patient management, we're really talking about being able to use this information for the clinicians to help manage a patient's course of care.
It really is weaving these pieces together to create behavior change that has lasting health outcomes for the patient.